I'll actually talk about the next genetic condition, which is known as what the Fragile X syndrome. Now, the Fragile X syndrome is best explained by this picture. You see a normal X chromosome. You see how normal it is. Now, if an X chromosome is having a fragile site, okay, it can it's not normal again. You know, one funny thing about all this genetic stuff is just a minor change, okay, could result in so much problems. Okay, so if it is not, it has a fragile site and all that, right? It can result to fragile X syndrome. Okay, and this is a syndrome that we will be talking about the characteristics in individuals that have this and all. So with that, the fragile X syndrome is an important cause of what hereditary mental retardation, and is actually second in frequent, okay, only to Down syndrome. So Down syndrome will cause most of the hereditary mental retardation, but this fragile X syndrome is next. Okay, so don't worry, we'll talk about this, the features. Now, the cause is cytogenetically demonstrable defect on the long arm of the X chromosome, and this will lead to what chromosomal breakage in vitro. The Fragile X syndrome is considered to be an X-linked disorder. However, the pattern of inheritance has a number of unusual features. Both males and females can be what? Asymptomatic carriers. Alright. Now, such carriers have an increased number of what? CGG. That's a cytosine and guanine tandem repeats in the 5' untranslated gene region of the familial mental retardation gene. Okay. So now this increase in number of repeats is referred to as what? Permutation. In carrier females, not carrier males, permutations can expand in the germline to even greater increases in the number of what? Tandem repeats. And these increased numbers are referred to as what? Full mutation. So just back here to talk about the symptoms. The person will be having symptoms and signs. You'll be having an elongated face and a broad forehead, having a large protruding ears, having a prominent lower jaw. Okay. Then on the system, you'll be having mental problems. Okay. You'll be having increased joint mobility. I'll be having what? Macro orchidism. That's like your testes will be so big, large testicles. Okay. You see that. Then in carrier males now, these are the transmitting males. They can transmit pre-mutations through their daughters, who remain clinically unaffected but who can become carriers of X chromosomes with full mutations due to a germline expansion of the repeats. Carrier females can transmit the affected X chromosome to both sons and daughters. Right? Sons with full mutation exhibit mental retardation, often bilateral macro-orchidism. That's what we've already spoken about. Big testes, right? And the genetic defect can further be transmitted to all of their daughters, right? Daughters with full mutations may or may not exhibit mental retardation, so that the symptoms are mild in what? Females, okay? So now this unexplained phenomenon is possible due to what? The selective X inactivation. Okay, so it could be that the X that is inactivated is the X that is already affected, so it's not shown off. Do you understand? So now, in which affected females have a greater number of what? Somatic cells with full mutations than do unaffected what? Females. Okay, so guys, that's it about Fragile X syndrome. Okay, see you guys next tutorial.